Hi guys, welcome to today's video. We're going to be talking about some of the common causes of sore throat, some home remedies that could be used to improve them, and importantly at the end I'll go through some of the more dangerous features of sore throat that I think everybody should know about. Disclaimer alert, this information is for educational purposes only and it's not there to guide your health decisions. If you've got questions, you've got to speak to healthcare professionals. Not just any healthcare professional, your own doctor, your own pharmacist, your own physician associate or nurse practitioner. They know your history, they know a lot more about your allergies, so it's important you do seek advice from them. I'll start with the commonest category, and that tends to be viral infections, your cold, influenza, and other viral infections that roam around in the community. At the moment, there's this big virus called COVID going around. I don't know if you've heard about it. Sore throat isn't a classic feature of it. It tends to be things like high temperature, cough, changes in smell or taste. But I did get a sore throat. When we talk about other viral infections, we're talking about influenza, the flu, we're talking about common colds like rhinovirus, but also something called glandular fever, mononucleosis, and these can all cause you to have a sore throat. These account for about 80 to 90% of sore throats in primary care where I work. So on an average day when I see a few sore throats, they will probably end up being viral. I know it's a bit of a meme that you go to see your doctor and they say, you don't need antibiotics, you'll be fine, take some paracetamol. But honestly, it's the truth, like, you will be fine. These are all self-limiting conditions, certainly the common viral ones. And importantly, it's about self-care, making sure you're drinking lots of fluids and taking things that will soothe your symptoms. The next one down is bacterial infections of the throat, like strep throat. Tends to be a lot commoner in children and accounts for about 30% of children's presentations with sore throat. Importantly, people can be a lot sicker with these, so they have clinical signs that indicate that they're unwell. So high temperatures, fast heart rate, respiratory rates are raised, and often antibiotics are needed in those severer cases. Other causes could be allergies or irritants. So often people who have allergies can get symptoms of a dry throat, and especially if they're working with irritants, they can also get certain reactions in the throat. That's why as doctors we ask loads of questions. That's why we're nosy and we want to know where you work, what kind of equipment you're using, because that all kind of helps us piece together if there is something that you're doing at work that could be causing your sore throat. So allergies is number 3. Bit of a curveball, but reflux, acid reflux, where a little bit of acid can come out from your stomach because the sphincter is not very good and it can leak through the food pipe and irritate the back of the throat, especially if you're lying flat, can also cause a sore throat. And often patients will say, well, I've not got any other symptoms of an infection, so I've got no temperature, I'm not feeling unwell, it's just an irritating sore throat, and that can be a little bit tricky to diagnose, but I think it's worth knowing about that. And last but not least, rare, I have to emphasize, but in a smoker who is elderly, I always think about cancer. It's a little bit like WebMD. You write sore throat and it can come out with a whole load of things. The caveat to this is if a sore throat is not getting better within the expected time, which is usually around about 2 weeks, give or take, because everything is a bit of a standard deviation. The normal distribution per se, you would say, is 2 weeks. There'll be some that will be slightly more, some that will be slightly less. If there's somebody who is 3 weeks plus and it's not getting better, then we have to think about what the cause of that is. Here in the UK, we would think about referring them to an ENT specialist, ear, nose and throat. And often it's important to do that so that we rule out something like a cancer. Right, we're on to the home remedies. So the first one is, let me just show you. 1 glass of warm water, half a teaspoon of salt, chuck it in, give it a good whirl. And then all you have to do is gargle it. So you take it in, you don't swallow it, gargle, often useful to pop your head back, and then gargle, spit it out. So if you do that for the whole of the water, do it twice a day, morning and evening, and it's often very, very good for a sore throat. This one may sound obvious, but basically drinking lots of water, if you're well hydrated, your body is able to fight off the infection far easier. Easier? You get me. Your body's like, cool, I got my ammunition, I'm gonna go fight the battle, and you can just chill. Having food that is cool and soft can sometimes help soothe the throat, so that's like having a banana or some yogurt. They often are good for the throat in the sense that if it's irritated, if it feels hot and tender, that can just help it cool down. Importantly, it's not going to necessarily make you better quicker, i.e. if you've got a sore throat for 2 weeks, you'll have a sore throat for 2 weeks. But what it will do is in that period of time, it will help manage your symptoms being far less severe. Next one is sucking on ice lollies, ice cubes, or anything else that's cool, but also hard sweets. Again, they cause a soothing effect on the back of the throat, which can be quite nice if you have a sore throat. I would say try and avoid irritants for the throat. That includes spicy foods, citrusy things, smoke, cigarette smoke specifically. Even if it's passive smoke, that can still irritate the back of the throat. Make sure you don't give an ice cube to a young child. Don't think you need to explain why you shouldn't do that. We talked about the cool stuff, now it's about the hot stuff. So herbal teas, honey mixed in with tea, these kind of things can have a soothing effect on the throat, and that's often something I use as well when I've got a sore throat. Nice cup of tea and lots of rest. Jumped ahead, I've already used the next one, rest. Doctors always tell you to rest, and that is a reason for that, because we've run out of other things to tell you. No, that's not the reason. The reason for that is that when you're resting, those troops we talked about in your body that go off and fight the battle with the water supply that you've given them, it just allows your body to have a good old time battling your infection. You don't want to give it extra stress by doing a marathon when you're ill. That's just not a good idea. And rest is another one that's really important and often overlooked. The caveat to all these home remedies is that if your sore throat seems to be very severe, you seem to be getting a lot worse or unwell, you do need to speak to a healthcare professional, because you could have the bacterial sore throat or other types of sore throat. And you don't want to kind of be sitting on the sidelines doing these for a bacterial infection, because it may not necessarily work and you may need antibiotics anyway. So do speak to your healthcare professionals. Okay, so we're almost there. When should you seek help with your sore throat? I think generally speaking, if you have a very high temperature, you feel the sore throat is very severe, you feel unwell in yourself, so you're shivery, you're vomiting, you're having difficulty breathing, any of those kind of things, and I would say certainly speak to a healthcare professional. It also depends on your own health. So if you've got immunocompromise, which means your immune system doesn't work very well, either because of other conditions or medications that you might be on, then I would be more cautious and certainly seek help with your sore throat. Sore throats, generally speaking, take about a week to 2 weeks to get better, sometimes a little bit less, but anything over 3 weeks, I would certainly be speaking to a doctor, and sometimes I do send patients through to a specialist, an ENT, ear, nose and throat specialist, if they have some worrying features. If they're smokers, if the sore throat's not getting better, if their voice changes like it's hoarse, if they've got difficulty swallowing, all of these are what we call red flags, so things that trigger for me a concern. Speaking of red flags, there is one condition I also always warn my patients about, and that is something called a quinsy. Quinsy is an abscess at the back of your throat, and if it starts to expand, often it shifts everything across there. So your uvula, the dangly bit, may also shift. People may often have problems with swallowing, they may be drooling, and they may have difficulty breathing. These are all very, very alarming symptoms. I would say emergency help will be needed. Quinsies often are a lot severer than a sore throat, so patients may have high temperatures, they may also feel clinically, so generally how their body is, unwell as well, so definitely look out for that one. That brings us to the end of the video today, and if you've enjoyed it, you've watched this far, then I would appreciate some algorithm related tasks. I think you may know what I mean. If you're not a subscriber, I make health and medical videos, and I would be super grateful if you did subscribe and hit the bell. The question I have for you today is, what home remedies have you used for your sore throat, and which ones have actually worked? I'll see you on the next video. Peace out.